the idea was to see who are the patients or subpopulation of patients that actually do better with venous stenting using the Vici stent system. And multiple variables we'll look at, both physiologically in terms of patient characteristics and also anatomically in terms of lumen shape before and after the stent placement. And we did both multivariate and univariate analysis. In terms of the threshold for significant improvement in clinical symptoms, we use both the traditional 3-point drop in VCSS score and also a more stringent 4-point drop in VCSS score. It turns out that when we use a 3-point drop in VCSS score, the features that were correlated to a significant improvement to clinical outcome included one, patient symptomatology before the procedure. So the higher the symptoms, the more symptomatic they were, the more relief they experienced. The other two had to do with the lumen morphology after stent placement. So the lowest the aspect ratio, that's a measure of how circular the vein looks after placement of a stent, and luminal area. Both were highly correlated to improved clinical outcome as measured by VCSS score. When we look at the threshold as 4-point improvement, which is a much more stringent improvement, two other features also were significant. Number one was the etiology of venous disease. That's thrombotic versus non-thrombotic. Now, the difference in this trial versus the other 3 pivotal trials is that thrombotic in this in VIRTUS trial were only chronic occlusions. They were not acute thrombotic. So acute thrombotic patients were excluded, and chronic post-thrombotic patients have the worst outcome. And that constituted 75% of the patients in VIRTUS trial. So chronic post-thrombotic versus non-thrombotic, there was a difference. Also, stent location, that when the inferior aspect of the stent extended into the common femoral vein and under the inguinal ligament, there seemed to be a correlation to outcome in those patients. We've always assumed, or those of us who do a lot of venous intervention, based on our own experience, thought that there were certain things that are correlates of improved outcome to the patient, in the patient populations we treat. And by that, I mean both clinically and also anatomically, like patency and improvement in patient symptoms. But nobody had proven those. This is the first time that in a prospective multi-center study with corelab adjudication of data, that we're actually looking at these variables and to see which ones correlate to improve clinical outcome. And the data we just talked about were the correlates of improved clinical outcome, not patency. The patency analysis is coming. It's not complete yet.